well-regulated militia being necessary to the security of a free state, the right of the people to keep and bear arms shall not be infringed. Welcome to another edition of Bearing Arms, Cam and Company. My name is Cam Edwards. Glad you're with me on the program today. I know we don't normally do a show on Friday, but for the past couple of days, I've been trying to share this conversation I had with John Diedrich from the Milwaukee Journal-Sentinel earlier this week. I did not want to wait till next week, especially when we got a holiday weekend coming up. So I decided, you know what, let's break with tradition here. And this is worth it because we are talking about an important topic, talking about the mental health of gun owners. John is the author of this series of the Milwaukee Journal-Sentinel called Behind the Gun, which we've talked about quite a bit over the past 3 or 4 months. The idea behind this story was to not name and shame gun owners, not advocate for more gun control, but actually look at what gun owners and what Second Amendment supporters are doing to support mental health, to provide an outlet for gun owners to temporarily store their firearms if they need to get them out of the home. But again, also to take care of ourselves, to make sure that we are still here when we are going through what can seem like insurmountable struggles. And so we've had John on. We've had a couple of his the folks that he's talked to on the program. Chuck Lovelace, who's a gun store owner up in Wisconsin. And last week, they held an event in Wausau, which was all about the intersection of mental health and guns. As John admits, maybe that title was a little clunky, but this is, I think, again, a very important topic and one that we should not be afraid to talk about. Acknowledging the mental health struggles that all of us, many of us will go through at one point in time. Talking about the fact that there are more gun-involved suicides than homicides. And how do you reduce those numbers? That's not a conversation that should be left up to the gun control activists and the people who believe that the only way to accomplish that goal is to strip us of our Second Amendment rights. Plain and simple. And there are a lot of gun owners in the Second Amendment space who are doing valuable work that is largely ignored by, frankly, not just the media, but in many cases, gun owners themselves. So the thing that I liked about John's series is that it did not take an anti-gun tone. In fact, again, I think he did really valuable reporting in highlighting the work that gun owners are doing to improve access to mental health, to provide gun owners with an option if they need to temporarily store their firearms away from their home. And again, doing these things without putting new gun control laws in place, without trying to red flag half the population or say, well, you know what, we'd all just be better off if you don't own a gun anyway, right? Again, this isn't a conversation that we can leave up to the gun control activists, the people who say that the answer is to simply discard our right to keep and bear arms. And I appreciate John actually shining the light on the work that the gun owners are doing. So without any further ado, here is our conversation, with John Diedrich of the Milwaukee Journal-Sentinel. Take a look and a listen. John, thanks so much for coming back on the program. It's good to see you again.
Yeah, thanks, Cam. Thanks for having me. Good to be back.
And this sounds like an incredible event last week. This was in Wausau, Wisconsin, right?
Yep, that's right. It's right in kind of in the center of Wisconsin. About 40,000 people live in Wausau, but it's really sort of the gateway to the north part of Wisconsin, which is much more rural and lightly populated area. But yeah, it was at the university sort of theater up there in Wausau. And
I know that there were some folks who've been on Cam and Company in the past. Mike Sedini was there. I believe Jake from Walk the Talk America was there as well, right?
Yep, they both flew in from Nevada. Those were our kind of out of state guys. What we had is 7 sort of panelists on stage, which is a lot. And we broke them up in different ways. What we did is we started off, and we'll have the video, to share. We have that out there now. But we started off with 3, we called them internally tiny TED Talkers. Basically, 90 seconds to 2 minutes. Here's one thing I want to tell you. And Jake was one of those. And then we also had somebody who was a researcher from the medical college, and then a retired police officer from Madison. All have been working in this space around mental health and firearms. And they spoke really briefly. And then I sat down with Mike was on the panel as well as a gun shop owner who's launched the Gun Shop Project here in Wisconsin, Chuck Lovelace, Mike Ashinger, who's done, he's retired Command Sergeant Major from the Army, who does a lot of interventions with soldiers. And then a woman named Debbie Trader, who founded Prevent Suicide Wisconsin from Wausau, and also a gun owner. So really everybody on our panel was a gun owner. And then Jake obviously is a gun owner as well, and the others are quite familiar. Gene, the retired police officer, obviously carried a gun for 30 years, so familiar. So that was kind of the tone of the group. We're all gun owners.
So, and again, that's a fantastic panel. I after you and I spoke about your series, I had Chuck on the program and had a great conversation with him as well. I'm curious if the panel was what you wanted it to look like. What about the audience? Because again, this was an event that was designed for gun owners, right? I mean, you wanted gun owners in the audience. You wanted to reach that audience. Do you think that you were successful in doing so?
Well, it's interesting that you say that because we worked really hard on filling the room, and by that measurement, we didn't fill the room. I'll be clear on that.
Okay.
And it's tough. I think what this speaks to is the issue of what we're trying to go after here. So on the good side, on the positive side, everybody that I invited showed up. Like this is basically recapping the project, the Behind the Gun project, where we really looked at the fullness of gun deaths and leaned into solutions, particularly coming from gun culture and people in gun communities. So that was sort of in a way that was straightforward, non-shaming. That's sort of the tone of what we were going for with the project. Everybody that from the project that I invited came. So it wasn't just the people who were on the stage. There was another 3 or 4 people in the audience who we called upon. These are people like Dan Marcon, who's pretty well known in the social media space. He's from Eau Claire, Wisconsin, and has this very compelling story of almost how he took his own life, and how he has found his way out of that and to work with other people. Kurt Green, who's the coroner from Manitowoc County, we featured him. He was in the audience. We had a couple, the guy who did the polling for us. We did the most in-depth poll of Wisconsin gun owners ever, and he was in the audience. So we had this like really high value audience. The question that we came away from is, did we just get the ordinary, everyday, if you will, gun owner to come in? And I think in hindsight, that's a tough ask because a couple reasons why is one is the event is at the intersection of firearms and mental health. That's a lot, right?
Right.
Even when you don't use guns, which has got kind of the other term, firearms and mental health, and if you're having some struggles in that space, maybe this isn't the event you want to come like self-identify at in the audience. Just we sort of thought about that, but we reached out. There was 5 gun stores that were that sponsored the event, and by sponsor, what they did is they donated items that we gave away.
Okay.
So we gave away gun safes, gun locks, ears and eye protection, range time, training time, gunsmithing. Chuck gave away gift certificates. We had a nice array and so those gun shops were also spreading the word in their areas among gun owners. So we did get some people, but what we really came away from, and at first when I looked at it, I was, hey, I wanted a full room, and there were people in the audience for sure, but it wasn't the big room. But we got this video, see, and that was golden because that allows, I believe, people to look at it later and understand. I was telling my people, I said, it was part of to me, the mission of what this night was bringing people together who've never met each other in one room. I've been blessed to meet all them and interview them and honored to tell their stories they had never met. And so part of this is that I think about in academia, sometimes they'll pull together people who are like kind of opinion leaders and activist type people, whatever they might be in their space, and almost have like a symposium of thought leaders in a space. And I think if we reframe it and thinking about it that way, it was a big success because of the quality of the content, the good video, the connections that were made. I mean, people who didn't know each other exchanging phone numbers and emails and saying, "Hey, let's work, some more together." People that I didn't even know, from the project come into the space. So a lot of connections made, and I think seeds planted, and it'll be interesting to see, what gives life to that in the weeks, months, and years to come.
I'm glad that you reached that conclusion about the importance of the video on your own, because that was something that I was going to say is that, this is, look, I mean, this is a difficult topic, right? And one of the things that you've written about is the fact that we don't like to talk about mental health, right? A lot of gun owners do get their backs up because as soon as you say mental health and you start mentioning gun owners and it's, oh, crap. All right, well, what are you going to do now? You're going to red flag me? You're going to try to, I mean, so to get gun owners to sit down, you're right. There is that stigma attached, right? Well, if I go in, are people going to think that I'm suicidal, that I have mental health problems? So maybe I don't want to go. But if you're sitting at home, right, you can watch this video. You can take it in. It's maybe a little bit more anonymous in that regard.
Yep.
But you're also, again, that second component, as you talk about, is building this community, right? So that when people do seek help, when they say, I'm struggling or my family member is struggling, I don't feel comfortable having firearms in my home right now, but I don't want to get rid of my guns. I don't want to sell them. That there is a broader universe of options available because of those connections that have been made from those folks on the stage, the people that you talk to, right? There really are two groups of people that can benefit from this. There's the, the folks who again, maybe struggling with mental health at some point. And then there are the helpers, the folks who can say, well, listen, we can do this to help you out. And I hope that both of those groups will listen and watch this video and take something away. And it sounds like, again, this is, you see this as a beginning and not as an end.
Yeah.
Is that fair to say?
Yeah, it's interesting that you put it that way because when we sort of plotted out the project, a lot of times a public event will sort of come as the capstone or the end of this. This feels different. This feels like, to me, this was a moment, and we've already been asked about recapping this event in different parts of Wisconsin, and because so. I mean, one of the people who came, who wasn't quoted in the project, but is very interested in hearing more about this, is a doctor, Dr. Jim Bigham. He's a physician, family doc from UW Madison, which is by reputation and reality a very liberal place. And that's where Chuck used to be. He was in Dane County, and he's now up in Park Falls, northwest of Wausau. But so Dr. Bigham has pioneered this program where he's training med students on firearms awareness. So a cultural competency program to understand 50% roughly of your patients are going to be gun owners. And can you talk about that with not stepping in it? Because you're probably not a gun owner. I mean,
Right.
Maybe they are, but most are not, I guess, is what he's telling me. But he takes them out to the range and they shoot and they talk. And I haven't been there for the whole thing, but he was very interested in the tone of the conversation. And I would just urge people, if you can, I mean, it's an hour and 15 minutes, and I know we all are busy, but get a chance to watch it. And I feel kind of funny about saying that because I'm like, hey, it's my thing, so watch it. But people who I trust have watched the video and said there's something just almost like you could see the chemistry among the people on stage, and you could see a quality, and you could see conversations that people are like, I mean, many people have not seen somebody like a Mike Sedini, who is, I think, by many measurements, one of those change agents, that we think about in time. They change the conversation, and Jake as well. You think about Debbie Trader. Oftentimes people who work in suicide prevention space they're pretty. They might be gun neutral or gun anti-gun. Um, that's not Debbie. She's grown up around guns her entire life. She and her husband have done those sort of like familial, going sitting with family and friends and being able to have people have them hold guns for a period of time. She talked about the hunting culture and so forth. It was super powerful. And then you had a real theme of veterans coming through the conversation, because Chuck Lovelace and Mike Eschinger, and then also out in the audience you had Dan Marcon, and you had Jim Campbell was also there. He was in the audience, and you actually get to see, he was one of our, like, again, super high quality audience, where Jim is a retired Marine, 30 years, pioneered the honor flight in our area, has done a lot of training. The first question that he said to me when he got on the phone, this was before the event, was, is this an anti-gun thing? Like, that was the first, and that's pretty typical in a lot
Right.
of the interviews that I've gone. And I'm not really thrown by it, because I understand it, I get it, and we have this conversation started, and then Jim is like all down with it. One thing that Jim brought up that I just wanted to raise was that, okay, so Jim is 76 years old. He is owned firearms his entire life. His dad died by suicide when he in the 70s, also a Marine. And he talks about just all the ways that people can take care of each other and get connected. He does a weekly meeting at the local Denny's, where like veterans in the area all come together, and it's just awesome. He's counted the number of people who've met there over the years. It's just like up in the more than 1,000 people have come through, veterans.
Wow.
Something hit him that Mike Sedini said that was really interesting, and Mike's probably said this on your show, but what Mike was saying was, he said, "Hey, if you're thinking about where to stage a gun in your house for home defense, you've played that through. You're working on your mechanics of, wherever you keep your firearm to remove it. You go to the range and plan. You need to do that same thing with your mental health plan. You need to be planning." Because you're failing to plan, you're planning to fail. And so, like you do with all the other training pieces of this, because statistically and very sadly, that firearm, as Mike said, is more likely to be used against you by you, just numbers wise, right? When you look at the numbers. And I know it varies, depending on where you are and kind of your fact situation and so forth in your life. But when he brought that forth in a way that wasn't coming from an anti-gun space, but as,
Mhm.
hey, gun owners taking care of each other, I'll tell you, it hit Jim Campbell, who's 76, and he's like, I've never thought about a mental health plan. I've got a son who lives in town. I need to come up with a plan by which, okay, if things change for me mentally, I feel pretty good right now. I get cancer, whatever the case may be. I need to have a plan, to be thoughtful about this. That plan may need to be adjusted over time, but just like you're planning all the other aspects of firearms ownership and defensive use and all that kind of stuff, that have this plan. And it was a real moment for Jim. He mentioned to me just as the event stopped that, like, that was something he wanted to lean into. And I would just add this to this level of conversation. It's almost as if people were let into somebody's living room to say, I get to see this really intimate conversation. And
Yeah.
people who are not in the space, and I'm thinking about people who don't own guns and would never own guns, are pretty blown away by this level. I will just say, of like, it disrupts the narrative.
Yeah.
That's what my journalism people talk about. They're loving it. I mean, I've got journalism folks that write about uh, disrupting the narrative, trusting news. I sent you some of these things. They love it, and it breaks it
John,
up.
it's one of the things that I love about this. I mean, you and I have spoken off and on for years, and I've always respected your reporting. But, I do like the fact that it does obliterate the narrative that we hear from people who want to, restrict my Second Amendment rights, that we don't care as gun owners about mental health, that, this is the gun lobby and they just don't, they're interested in money. Mike Sedini is part of the gun lobby, right? Chuck Lovelace is part of the gun lobby. Don't tell me those guys don't care. Don't tell me that gun owners don't care about these issues. So, I think this is an important topic. But I also like the fact that this does disrupt the narrative that we hear quite often. And the video that, I would also echo John, and I had nothing to do with this event, but this is a powerful video to share not only with other gun owners, but with people who don't own guns, with, your friends and family who may say, we need red flag laws, we need this or that or the other. This is a perspective that they don't get most of the time. And so it is critically important. Now, unfortunately, we've only got a couple minutes left, but I don't know if you and Mike and Jake maybe talked about this, but one place where I think an event like this might go over very, very well is at SHOT Show, the Shooting Hunting Outdoor Trade Show in Las Vegas, because there you have tens of thousands of industry members, right? You've got FFLs, you've got an audience that I think might be more receptive and more interested in this topic because they see these customers come in. They may have sold a firearm to somebody who went on to take their own life. And I would love to see a follow-up event at SHOT Show in 2025 if you guys could make it happen.
Yeah, well, I really appreciate that. I have talked to Bill from NSSF.
Oh, yeah.
He emailed me coming into this event support. I think it's really interesting. I mean, a lot of our reporting had been around Wisconsin, but you're right. That event, we would have built-in audience. I think that's really intriguing.
All right. Well, I'm glad I could throw that out there. So if this is not the end, then where do you see this project going next, John? Are you through writing about this, you think, or are there more stories that you'll be putting out?
Oh, I think there'll be more. One of the things I was working on, as I mentioned, this healthcare, this mental health plan that gun owners can think about. Something that'd be very practical. One of the things people tell us right now is that, like a really practical sense, I want to know things, almost like we call them listicles or lists sort of thing. So what would be important for a toolbox when it would come to mental health, and tell a little story on the side, but give people really. And I feel like there's a space that I'm hearing not only about that, but from first-time gun owners. I think there's a real lack of solid information that I'm not going to say get a gun, don't get a gun, but if you get a gun, here's what the folks I've talked to have said are really important things to think about. I think that there's a real opportunity in that space. And I think a lot of that information has come out from the firearms industry, journalism, but that might not be read by like somebody who's a Madison liberal who's thinking about buying a gun, which is a thing that's happening, right? Like
Yep.
that's true. So I think people are looking for trustworthy information, especially not only around training, storage, and also mental health. And so those areas I think are really interesting. And I will tell you the other thing I'm really interested in is really leaning in and looking at unintended firearms deaths. Unintended is the CDC definition. Sometimes they're called accidents, sometimes they're called negligence, but they're unintentional. In other words, there isn't an intention. There's not a suicidal, homicide, or police involved intention. I think it's really interesting area, and I think it's actually a shared interest broadly that like huge parts of the community, whether it's people own guns or not, share and hold. And so I'm interested again to sort of lean into that and understand access, and how access can be available but not free. And they talk about can you ensure that this firearm is not accessible to somebody who's not authorized to have it, but it is accessible to you if you have it available for home defense. I think the fullness of that issue, I think there's a space there to investigate more. And I find that really, really interesting. We didn't write a lot about that in this because it is a small number. It's a small percentage, but it is intervenable in maybe ways that we haven't, that just could be explored again using the same ethic that we had in this project.
I'm looking forward to seeing the results of your exploration here. And John Diedrich with the Milwaukee Journal-Sentinel, again, Behind the Gun. It's the type of series that I wish we had more more of in mainstream media, because again, it I think treats the issue and it treats gun owners fairly. It doesn't start from the position of, well, look at these weirdos who are, owning firearms. That alone, I think, is noteworthy. But the folks that you talk to, the people that you uncovered, the information that you provided, I think is it truly is remarkable. And so, again, I can't thank you enough for your writing and you sticking with this. And I look forward to seeing what the future holds. And I'd love to have you back again very soon.
Thanks, Cam. I really appreciate it. And just appreciate you, creating a space for this conversation. It is huge. And I will say that I have been, your voice in this is really noted in a lot of spaces. And I will say my journalism circles, I can't tell you how many times I've shared that link of the original piece and the video and so forth. So know that your voice is and your endorsement of the project is resonating across journalism circles. And that's where we see maybe, again, some changes that come over time. Maybe they're incremental, but there are things on the move here.
I appreciate the kind words. John, we'll talk again very soon. And thanks so much for coming on the show today.
Thanks, Cam. Appreciate it.
My thanks again to John for joining me on the program. Now, listen, I want to tell you about a couple of, we talked about Walk the Talk America, right? They were part of this event last week. I would recommend if you are looking for a way to help, if you want to do something that can, again, make a difference, I would recommend Walk the Talk America. It's walkthetalkamerica.org. But also Hold My Guns. We've talked with Sarah Joy Albrecht from Hold My Guns. Gosh, I guess it's been a couple of months. And that is an organization that, again, is teaming up with FFLs to allow for the temporary storage of firearms. And they could use your support. So if you're looking for a way to help out, you want to be able to kick in a couple of bucks to one of these organizations, walkthetalkamerica.org and holdmyguns.org are both doing incredible work around the country. And they not only deserve your support, but they could use your support as well. All right, let's turn our attention now to today's Armed Citizen story, our good deed of the day, and our recidivist report. We will start there. I don't know if this is a true recidivist report or this was a first offense. All I know is that I'm a little bothered by the sentence here. A man from Olathe, Kansas, getting a suspended prison term and probation following a domestic violence incident. Yeah. I just have an issue. Anytime somebody gets hurt like this in a physical assault, and then the answer is a pat on the wrist, I don't like it. It bothers me. This is Douglas County, Kansas. Austin Kidder was actually sentenced to 26 months in the Kansas Department of Corrections, but a Douglas County judge suspended the entirety of that sentence and instead placed the 32-year-old on 24 months of supervised probation as well as 12 months of post-release supervision. Kidder was ordered to complete a batterer intervention program, according to the Douglas County DA, Suzanne Valdez, who said strangulation is one of the most life-threatening forms of domestic violence. She said, I want to thank the survivor in this case for the trust that they've placed in our office to seek justice for them. Charges against Kidder filed I think almost 2 years ago, after a August 16th, 2022 incident where Kidder strangled a then 33-year-old woman from Lawrence, Kansas, who had been dating. I hope that the victim is okay with the sentence, because one of the issues that we have sometimes with plea bargains in domestic violence cases is that the victim doesn't want to testify. It may be, again, that they have returned to their abuser. It may be that they are afraid of their abuser. But it is often, I don't know if I should say often, it is sometimes difficult to get that witness to testify. In this case, it sounds like the witness and the victim here was working with the district attorney. And I, again, hope that she is satisfied with his probationary sentence and the possibility of prison time for her abuser. But from where I sit in Central Virginia, I'm not. I've got some questions. Today's Armed Citizen story, and this, again, talk about having some questions. This is a weird story from Louisville, Kentucky, where a man was arrested after being shot in an alleged carjacking. And this was the alleged carjacker who was shot, apparently. Jason Calhoun is now facing 4 charges, including attempted murder, strangulation, and robbery, after an attempted carjacking that left him with gunshot wounds. Officers found Calhoun when responding to a call of an injury accident. They got there on the scene, and they found him in his car, having been shot. There was then another call of a possible carjacking on Interstate 65 at the Outer Loop in Louisville. Through an investigation, according to WAVE, officers determined that the 2 calls were related. The victim from Interstate 65 told police that his car had broken down. He had left, and then he came back in his wife's vehicle. And that's when the victim said he saw Calhoun walking behind his vehicle. And while the victim was sitting in the driver's seat of the broken down vehicle, the victim said that Calhoun opened the door and basically said, "Give me your keys." Victim said Calhoun made an attempt to grab a gun that was tucked between the driver's seat and the center console. And when the victim grabbed the gun, he told officers that Calhoun began to kick him. Victim actually told officers that Calhoun said, "You want to talk about a frightening phrase? Some guy you've never heard of or you've never seen before opens the door of your car, starts assaulting you, and then says this, 'Give me your eyeball. Give me your eyeball.'" Yeah, that's what Calhoun allegedly said before grabbing for the victim's eye, hooking his finger and sticking it into the eye socket in an attempt to remove his eye. The arrest report said after the victim was able to fight Calhoun off, Calhoun put him in a headlock and then began to choke him. Only then did the victim get control of the gun and fired multiple shots at Calhoun, was able to exit the vehicle. The arrest report says that as Calhoun entered the driver's seat of the victim's car, he reversed and was then hit by a semi-truck. Then he fled to Preston Highway in Outer Loop, where he was found by officers. He was taken to University of Louisville Hospital, scheduled to be in court this morning. The victim in this case not facing any charges. Hopefully his eyeball is okay and his eye socket is okay. That's going to be a phrase that lives in my nightmares from here on out. Give me your eyeball. Thankfully, he got a couple of rounds instead. All right, on to today's good deed of the day. In the right place. Give me your eyeball. Seriously. Anyway, good deed of the day. We need let's have some, mental soap applied to our brains here. Southern Illinois police chief performing CPR off duty, saving a life at a pool hall. No eyeballs involved in this case, I don't believe. Let's just hope that there were no eyeballs involved in this case. Metropolis, Illinois. Metropolis Police Chief Harry Massey is no Superman, but he was in the right place at the right time, willing and able to do the right thing. On Tuesday night at Sully's Billiards Bar and Grill, when a man collapsed there. Harry Massey's in a pool league at Sully's. He said a player on the opposing team who had just undergone heart surgery came in to watch the game. As they were playing, Massey says the man just collapsed and turned purple almost immediately. So Massey started performing CPR, gets trained annually through the police department. And he said, unless somebody was trained with CPR, his chances of survival were basically nil. He says, that's why I'm a huge proponent of CPR. The man did get revived. He was first taken to the nearest hospital, which is a Massey Memorial Hospital, then transferred to Baptist Health in Paducah, Kentucky. Massey says he thinks everybody, not just law enforcement, should be trained in CPR. He says it's an important tool to have in your toolbox. Just take some practice. But once you get the basics down, it is something that is very easy to learn and easy to maintain. And, we've heard that from some of our previous good deeds of the day, where people have said, I learned this 20, 30 years ago and never put it in practice, but it was kind of like riding a bike. It came back to me when necessary. So, again, in the right place, at the right time, willing and able to do the right thing to save the life of a man at a pool hall. Harry Massey, police chief in Metropolis, Illinois, we thank you for your very good deed. And that is going to do it for this edition of Bearing Arms Cam & Company. I want to thank you for being a part of the program. As always, I hope that you are going to enjoy a Memorial Day weekend. I don't know what your plans are. I was talking about this with my wife last night. We were doing our foul language podcast, and she said, have a happy Memorial Day. And then she said, do we really say that? I think we do. I mean, look, you got Memorial Day, appliance sales now. So the original intent, I think, has largely been forgotten by a lot of folks. But when I lived in Northern Virginia, I would always go to Alexandria National Cemetery, which was the second national cemetery established. And it's smaller, much smaller than Arlington, kind of tucked away. Hardly anybody ever goes there. And I would go and I would pay my respects to the fallen soldiers. We don't have a national cemetery close to Farmville, Virginia, but we do have Appomattox, where there are a few graves of some of those soldiers who died in the waning days of the Civil War. So on Sunday, I will be heading over to Appomattox to pay my respects. I hope that you get the opportunity to do something similar where you are, but I also hope that you do also have the chance to spend some time with family and friends, to relax, to recreate, do some shooting, exercise your Second Amendment rights, maybe do a little bit of grilling, celebrate the start of summer. And we will see you back here on Tuesday. But we will be updating BearingArms.com throughout the holiday weekend. I will say we'll be on a sort of a holiday schedule. We won't be posting quite as much as we normally do, but we will have content for you coming out throughout the weekend, including contributions from John Petrolino, Ranjit Singh, as well as Tom Knighton and myself. So I would encourage you to check out BearingArms.com. And of course, if you like what you see, I'd also encourage you to become a VIP or VIP Gold member. Just use the promo code SAVEAMERICA and you can get 50% off of your membership. You'll get an ad-free experience, exclusive content you won't find anywhere else, the ability to comment on stories, but you will also be supporting the independent pro-Second Amendment journalism that we are doing here at Bearing Arms. And I thank you for that because your support is vital. All right. Have a great weekend, everybody. We'll see you back here soon. Until then, be well, be safe, and be free.